Hi everyone, I'm Dr. Deepika Aggarwal, Director Obstetrics and Gynecology at Birla Hospital, Gurgaon. Today we'll talk about a topic called as pelvic inflammatory disease. Now this is a word some of you might feel कि ये आपको बहुत familiar है. स्पेशली कभी कभी हम देखते हैं कि रेडियोलॉजिस्ट जब हमारा अल्ट्रासाउंड स्कैन करते हैं, मे बी आप एक जनरल अल्ट्रासाउंड के लिए गए हैं, मे बी आप किसी कारण से वहाँ पर गए हैं, तो वो एक इम्प्रेशन लिख देते हैं दैट PID, pelvic inflammatory disease. Now what does that mean? PID means हमारे जेनिटल ऑर्गन्स के, रिप्रोडक्टिव ऑर्गन्स के ट्यूब्स, यूट्रस, ओवरी का इन्फेक्शन हो जाना. अगर ऐसा सा कुछ इंप्रेशन लिखा है, then you must see your gynecologist at least once for your advice. PID is of two types. It is acute and chronic. In acute PID, usually you will have symptoms. So आज हम डिस्कस करेंगे इसका डायग्नोसिस कैसे होता है, इसके सिम्टम्स क्या है और इसका ट्रीटमेंट क्या है. The symptoms that you can have in acute PID is you may come with fever, vomiting, pelvic pain, maybe pain or severe pain having intercourse, foul smelling discharge, or sometimes you may feel that you are bleeding every time after intercourse. अगर आपको ऐसे symptoms हो रहे हैं, then immediately you must see gynec. Having these symptoms doesn't mean you have PID. That could be because of other reasons, because of other infections also, but it is important to at least once visit. Now, how can we diagnose PID? PID को diagnose करने के लिए सबसे पहले आपके जो gynecologist हैं आपकी हिस्ट्री तो लेंगे ही, उसके बाद वो एक internal examination करेंगे जिसको हम कहते हैं per speculum examination. It's like a small instrument. We will put it inside your vagina and we will check the color of the discharge, whether it is foul smelling or not, how is your cervix looking, and we would also like to do an internal examination जिसको हम कहते हैं vaginal or bimanual examination to feel for the uterus and to check both the sides of the uterus. We might also want to do blood tests like your CBC and your CRP, which will tell us about infection. And when we are examining you, we also sometimes want to take the swab test, जिसको हम confirmation के लिए भेजते हैं, specifically for infections like chlamydia and gonorrhea. These are the main two pelvic inflammatory diseases. For the diagnosis further, we sometimes would like to do an ultrasound scan क्योंकि acute pelvic inflammatory disease अगर ovaries को और tubes को involve कर लेती हैं, then it can cause or lead to abscess as well. So why is it important for you to know about PID? PID is a sexually transmitted disease, which means it comes with sexual activity. What are the kind of women who can get it? If you have had multiple abortions, because multiple abortions means you're exposing your body to a more risk of infections. If someone has been using copper T or IUCDs in past, having said that, it should not really deter you from going for IUCD as a contraceptive, but occasionally these things can happen, especially अगर हम बहुत ही sterilized environment में नहीं ये procedures करवाते अपने gynec से जाके, then you can get these infections. And yes, if any women who have multiple sexual partners. So it is important that you should use barrier contraception if you are not in a steady relationship. And why is it important that you need to get it diagnosed? It is because sometimes acute chronic PID can go into chronic PID. Chronic PID can permanently damage our tubes and it can lead to infertility. कई बारी अनफॉर्चुनेटली जब हमें इस तरह के इन्फेक्शंस होते हैं बाय क्लेमिडिया एंड गोनोरिया, तो हमें कोई सिम्टम्स नहीं होता और सैडली उन वुमेन को तब पता चलता है व्हेन दे आर ट्राइंग टू कंसीव एंड वी सी दैट वन और बोथ द ट्यूब्स आर डैमेज्ड एंड वी सी अ क्लासिकल पिक्चर कॉल्ड एज हाइड्रोसाल्पिंग्स. उन सिचुएशन में there is not much as gynecologists that we can do to salvage the tube, but if you are coming to us in an acute state, we can definitely treat it. So what are the ways by which you can minimize or prevent PID? First is please use barrier contraception if you're not in a stable relationship. If your partner comes and tells you that he has acquired any chlamydia or gonorrhea infection, then you must go and see your gynecologist so you can be screened out for that as well. If for any reason abortion has happened and you need any surgical procedure like DNC, then make sure that you're going to a center which is well equipped and they maintain proper sterilization procedures. So in conclusion, it is important that please do not ignore the term PID if you see on your ultrasound reports, or if you have any signs or symptoms like discharge or pelvic pain or postcoital bleeding, you should see your gynec. I hope you will find it useful. Thank you.